In the UAE, there are many health insurance providers. In Dubai and Abu Dhabi, the cost of health insurance can be very high. However, there are local, more affordable providers such as AXA Gulf and Demand that can offer low-cost solutions. However, it's important to note that these plans would generally have limitations and caps on your benefits. To find out whether these plans would be suitable for you, please feel free to contact us.
Kendall in Bridgewater, South Dakota. Hey, Kendall.
Yeah, I'm a little bit curious. What difference does it make if everybody has health insurance and none if we have an Ebola outbreak in America? I've read it takes 25 medical professionals to treat each patient. It would take 1,000 or 2,000 cases in this country to totally overwhelm the system. And at that point, it isn't going to matter a whit whether or not we have insurance or not.
Well, okay, let's go through Public Health 101. First of all, it doesn't take 25 medical professionals to care for one person with Ebola, although it may take quite a few because you've got a quarantine unit. But those numbers will change from place to place. But the point is that if somebody has health insurance and if they get sick, they're more likely to go see a doctor and they're more likely to get the care they need, which means that sickness, particularly if it's a contagious sickness, is limited. The difference between Liberia and the United States is that Liberia has no public health infrastructure and the average Liberian has no health insurance. And here in the United States...
Wouldn't we be better off securing our borders and preventing the outbreak in the first place?
No, because this is not the only outbreak we have to worry about, Kendall. Do you know where 2 of the top 10 tuberculosis hotspots in the world are?
Well, India is one of them.
Well, New York and Los Angeles are 2 of them. It's already here, and it's not so much immigrant communities. These are just in poor communities. And again, it's because we have a very, very defective public health care system here that's run for profit first and for people second. So if we had a comprehensive, the 2 things that we need are, number 1, a national health care system that actually cares for everybody, literally everybody, so people can get health. And number 2, we are the only nation in the developed world of the 34 OECD countries, the richest countries in the world. We're the only one that does not require employers to give people paid time off when they're sick. And as a consequence of that, people who are sick come to work, and they bring you your plate in the restaurant, complete with some Ebola.
You're listening to the Thom Hartmann Program. Call 866-987-THOM.
Actually, more frequently than Ebola, they'd bring you your plate with flu. But, public health is public health. It's time for national paid sick leave as well.